Welcome to the Franken Steve Podcast with your hosts, Dr. Frank Williams and Dr. Steve Snodgrass, MD, FACS, where we discuss a broad range of topics without limitations. Let's get to it. Here's Dr. Frank and Dr. Steve.
Hello, welcome back. This is the Franken Steve Podcast. I'm your host, Frank Williams, and this is Dr. Steven Snodgrass, MD, FACS, tech extraordinaire, as we're going to be talking about a project that Steve and I put together that kind of encompasses several different aspects of things we've worked on for years. It's called the ARTIE Project, ARTIE, and it encompasses everything from art to blockchain to healthcare, and then the many different ways that we can enhance people's lives and at the same time hopefully help you to, if you're looking for, because it's also a crypto project, there's a big component of that in there, can help you to maybe look as the crypto markets are going crazy, can help you to look at somewhere where maybe you feel a little safer putting your money and watch it grow. So the ARTIE Project basically, and I'll let Steve give his interpretation of it also, but the ARTIE Project is basically a blockchain project, which is the digital art part of the Snodgrass Art Gallery, which is Steve and mine's online art gallery. So that art gallery allows people to be represented, as many of you know from our past videos. It allows someone who creates art, and that's anybody. You don't have to be an established artist. You don't have to be a starving artist showing up at shows, whatever it is. If it's your kid's art on the refrigerator, as Steve always says, and you think that looks better than art that's out there, which you might, because a banana duct taped to a wall just sold for $6.2 million. So that's kind of insane. But if you need a place to go that you can actually become artist represented by a gallery, or gallery represented, I should say, then we're your place, because the Snodgrass Art Gallery, we allow you to come in, sign up for free, and then you just pay a small $5 submission fee. And what happens is we do all the advertising, we do the social medias, we do everything to bring attention, and then the artist actually receives 100% of what their asking price is. Our money's actually made off the submission and off the back end, which is automatically upcharged at 20%, so that you're not out anything if it's something you want to create and something you feel you want to sell. You never know, because beauty's in the eye of the beholder. Even if you don't think you're that good, you need to give it a try. And that's any type of art medium, whether it's painting, sculptures, drawings, anime, digital, NFT, any of those. We have a platform for it, all built into the Snodgrass Art Gallery. And our digital and NFT platform and blockchain is called ARTIE. It's a character we developed, which you'll see as we do the little intro for him, and I'll let Arty introduce himself.
Bonjour, I'm Arty.
And so, as we came up with this character, we wanted something that we could use to inspire and both not just encourage, but kind of a professional but playful character that can be utilized in all the different assets and facets of what we're actually doing in the project, which I will go over here shortly, and Steve will go over with us. So the character is an art character, obviously, as you just saw. And one of the things we wanted to do is utilize that to help us enhance for our donations that we do, and for the funding and the fundraising for research projects for art therapy. So art therapy is near and dear to Steve and mine's heart, as you've heard in past videos, because either a family member or like Steve has personally been through this, where art therapy actually can help the healing process, can decrease hospital stays, can decrease the need for medications. And Steve, if you'd like to explain your healthcare model again, and for those who haven't seen that video, it'll kind of tell you just what kind of savings are actually out there conservatively.
Yeah, we put together, there's a lot of literature in regards to art therapy and then healthcare savings and things like that. And we know that art therapy decreases the length of hospital stays, the hospital readmissions within 30 days, and then the pain and sleep medication requirements, all of which are very important variables. And we put that together with the actual monies that are listed in regards to what these things cost. Mm-hmm. We did a conservative estimate. We just said like, okay, let's say that you save one day, just one day of worth of hospital stays. And it came out to, and I got a PhD in math to help me with it. Mm-hmm. And they looked at all of these numbers, all of these variables. We put it all together, and a conservative $105 billion a year would be saved.
Art Therapy Healthcare Savings Model, presented by Williams Snodgrass Art Gallery. The most frequent diagnoses for hospital stays are septicemia, heart failure, osteoarthritis, pneumonia, diabetes. The average cost of a hospital stay per day in the U.S. was $2,883. Kaiser Family Foundation, 2021. For 36.4 million patients, the average length of stay, LOS, in the hospital ranges from 4.5 to 5.5 days. Also, the average length of stay, LOS, in the hospital ranged from 4.5, Hospital View 2023, to 5.5 days for 36.4 million inpatients. National Center for Biology Information, National Institutes of Health, 2018. Pain reduction from non-medical sources, such as art therapy, is associated with a savings of $898 per admission. Art therapy has been associated with decreased length of stay, as well as decreased pain and sleep medication requirements. For example, an average LOS is 5 days. This means that the average cost of a 5-day stay is $14,415. 5 days length of stay x $2,883 cost per day equals $14,415. Comparatively, if we were to reduce the LOS by just 1 day, the average cost of a 4-day stay is $11,532. Considering there are 36.4 million stays each year, this equates to a savings of over $104 billion per year. 5-day LOS. Average cost, $2,883 per day x 5 days x 36.4 million people equals $524,706 million. 4-day LOS. Average cost, $2,883 per day x 4 days x 36.4 m people equals $419,764,800,000. 1-day LOS. Average cost, $2,883 per day x 1 day x 36.4 m people equals $104,941,200,000 equals $104.9 billion. Now, pain reduction by non-medication means is associated with a cost savings of $898 per hospital admission, which gives an annual savings of $32.6 billion per year. Together, a 1-day decrease in LOS plus savings in drug costs amounts to a reduction in healthcare totaling $137.6 billion, $137,628,400,000 per year. 10-year savings projections are then $1.376 trillion, $1,376,284,000,000. Art therapy may significantly reduce healthcare costs and improve patient outcomes as well as quality of life, and should be offered as part of usual and customary care in both inpatient and outpatient settings, covered by Medicare, Medicaid, and private insurance.
And not only the financial cost, but again, you all have heard me say this many times, but if you look at what kind of costs are involved in healthcare, it's mental, physical, and financial. It's, this is a business unlike any other kind of business, because you're dealing with humans in a way that they are compromised, and the families are hurting and compromised. And so what all of this is about is about healthcare, helping you be your own advocate, and then applying all these things to make any kind of unfortunate illness or injury, make it better on you, because it's going to be bad no matter what, but we try to make it better.
Right.
And we wanted Arty, we wanted a relatable character, because it's one of those things where it's not just for kids. It's great for kids, but it's not just for kids. It's somebody to remember, hey, it's Arty, and they'll know it's synonymous with us.
Right.
And that's the thing about cryptocurrency, as we all know, is like, people complain about the fact that there's a lot of thieves involved and all that sort of thing. I hate to tell you, but there's a lot of thieves involved in the U.S. dollar as well.
That's the number one money. I've heard congressmen and senators say, oh, it allows for criminals. It's well over 90% of all money laundering is still done in cash, in U.S. dollars.
Yeah, so it's like when the argument of saying like, oh, crypto is going to promote criminality and that sort of thing, and it's going to be, it's
just ridiculous.
Well, a lot of times, you use the word ignorant, and I can say that was applicable to me in regards to a lot of technology and crypto things. There's a big difference between ignorant and stupid.
Yes.
Ignorant is like, well, I've never been exposed to that. I don't know anything about that, but I'm willing to learn. And like, you show me, and I take it and I apply it, and then I take it later and don't do the things that we learned that are the right things to do. That's stupid.
Yes. And there are a lot of people get offended with that word ignorant. I use it on myself. I'll say, hey, I don't know that subject very well. I'm kind of ignorant to the fact or the facts on that or the research. Let me check it out. There's nothing wrong with that. If you're ignorant, you're ignorant.
Yeah.
But the good thing is, hopefully you can learn and become educated.
And I think the whole reason I bring it up is because I think there's a lot of ignorance in regards to cryptocurrency. I mean, there's so many rumors and lies and falsehoods just flying around out there, and they're baseless.
Correct.
They're absolutely baseless. And if you look at it, at one time, I looked at like the history of money and that sort of thing. At one time, cattle were used as payment. So it's like we've evolved. We have evolved. And so there's always going to be change, right?
Right.
The only thing constant is change.
Well, look, right now, you've got the BRICS system trying to take over for the U.S. dollar, which is not going as well as they thought, but they thought they would supplant the U.S. dollar as a U.S. reserve currency.
Yeah. And I think
Not
that
happening.
And the other thing too about our cryptocurrency, Arty is kind of a multi-phase project. And the first phase was an art show that we did at Vanderbilt University Medical Center, and I've got to say it went very well, and we were very pleased with that. And it's in regards to the thing about the whole Arty project. It's not just for patients in art therapy, even though that is a major goal and major objective. But the other thing too is it's for we've broken our market, if you will, into non-patients as well as patients, and that's pretty much the world.
Yes.
And whether you're a patient or not, you're going to be one if you live long enough, no question about it. And so we want to stimulate beauty, creativity, and let that just run wild all over the world, because getting this gallery representation, like I say, I had no idea how difficult that was. And you're looking at 99% plus of people who create art. They're never going to get representation in your standard brick and mortar gallery.
Right.
And the other thing too I want to say about our gallery in particular is that if you look at what's out there, think about it. They charge monthly fees, and the monthly fees can be substantial amounts of money. And then they take a lot of times 50 to 70% commission. And so if you're an artist, and by the time that you pay and buy your supplies to create your art, you pay a monthly fee, and the art may not even sell. So while it's not selling,
and then they have other little areas of courses and things they want to sell you in between to keep you current or to tell you, to help you with your sales when you're just an artist creating it.
Yeah. And so by the time that it's all said and done, you've created a piece of artwork and you're in debt.
Yeah.
So it's like, what we wanted to do is say like, okay, hey, we're all for you. We want to try to make it as easy as we can for you. And may I say, we're honest.
Yes.
We're honest about it, and we're very reachable. So if you got a complaint or anything like that, we're very reachable. It's not like you're going to tap into something that doesn't exist as far as a complaints department.
Exactly.
Because we're here for you. We're on your side. And so we want to see that artwork. We don't
the
care.
more successful they are, the more successful we are.
Absolutely. And so like if you're 5 or 6 years old and you create a piece of art and your family looks at it, it's like, you know what? That could be something. So let's put it out there and see. And it costs $5. Mm-hmm. It costs, that's really.
And you can charge any amount that you want for it. So if an aunt, uncle, grandma, grandpa, mom, dad, sister, brother, friend want to buy that piece of art for you, we encourage that, because nothing, as Steve has said, gives you a greater feeling than not just creating the artwork, but then actually selling the artwork so you feel like your creations have been appreciated.
Yeah, and it's validation and appreciation is just it's just such an important thing.
Yeah, so as Steve was saying, the first phase of the Arty Project, which is like I said, is part of the Snodgrass Art Gallery, but it's its own separate entity, was to have this art show to benefit art therapy for the Vanderbilt University Medical Center and its patients. And so it's going into the cancer centers, from what I understand currently. But all that was featured off of Steve's art. And so we had a 2-hour art show. It was a great success, raised about $50,000, which is impressive for a 2-hour show, with cash and like-kind donations. And so we said, how can we continue this? So we were working with other charities and other organizations to bring them on board to let us help, because our goal is, like Steve said, it's multifaceted. So we have the gallery, which we want everybody to be able to come on, patients, non-patients, anybody, anywhere in the world globally can get on and become gallery representative. We'll supply you with a letter if you want, with our letterhead and everything. And it's a beautiful letterhead, if I might say so.
It is.
It says William Snodgrass Art Gallery. We have a very successful artist on it. So it's not like some fly-by-night organization, but our passion lies with donations, as we donate to veterans groups, children's groups, to different organizations. And if somebody has an organization, they want to contact us to look at partnering or us becoming a fundraising avenue for them, we're more than happy to look into it. And so that's big, because art therapy, while it's been around since the 40s, as we've spoke about, so we won't drag that out too long, but art therapy has been around since the 40s for the VA centers,
yes.
In the VA hospitals and the VA system. And it's still, even though you have therapy organizations that have been around since the 60s, they haven't accomplished much. So our goal is to actually help to make art therapy usual and customary. And that's not the main goal of this video today, but that is one of the goals of Arty, to help that out with research, donations, and fundraising for the different organizations, or for doctors or clinics or organizations that actually do things like double-blind studies,
yes.
as you call them,
yes.
and to prove that. Because if it's usual and customary, they can then charge both private and government insurance, Medicare, Medicaid, and actually bring more therapists on and actually have complete departments that help with that. Anything that goes into patient care that helps cut down on cost, not just from the standpoint of the insurance companies and hospitals, but from the parts you're responsible for, it can cut down on as far as financial and as far as stress, as far as physical health and healing. So Arty has a big goal and a lofty goal, but I think with what we've done so far, we're getting there, and we're proving that we're willing to put both our time, energy, and Steve and I have invested a ton of money, time, energy, tech development into this. So that kind of explains where we're at. And so what we were looking at is, how can we utilize, when we go to digital art and then digital platforms, and Steve and I, as many of you may know, we've been in the crypto sphere since about 2017, somewhere like that. So for about the last 7 going on 8 years now. And have been big proponents of it, knew what it was going to do, knew what it could do, and knew, that it would become commonplace. And look for the U.S. to lead the way this coming year and for years to come. But we designed the Arty Project, and you'll get the link for the Arty Project, to develop blockchain technology like our NFT platform, where you can actually create, list, sell, exchange, store your NFTs, stake them, which means that you can hold them for a while and they'll gain in value, most likely, unless nobody likes it, which that's hard because most of them always go up. We have already play to earn gaming, which means that as you're playing the game, you can also earn rewards from that. You can take those rewards and then store them, or you can exchange them for merchandise or cash them out, whatever it might be. So in creating all this, along with, and let me go back for a second, because we also created what's called educational systems. So they're like a rewards-based educational system. The courses are free to take, but as you go along, there are financial rewards as far as crypto rewards for you to gain as you complete the courses. Now, these courses are both for youth and adults. And the courses are something that we think goes right along with not just crypto, but also with blockchain and with everyday life, because a lot of patients stress over money, they stress over budgets. So our courses are based on financial literacy. The courses are based on like how to run your checkbook, how to debit, how to run a budget for the house. All these different things. There's many different type of courses that the Arty Project is offering and will be offering for people that, they're not overly complicated. They're explained very easily. They have videos. So there's something, you might want to take a course on healthy sleeping. So we have courses that can help you if you're having problems with sleeping or ways to de-stress. All these different areas are brought into our educational platform for Arty. And then, as we go along with the staking, the NFT platform, which are huge in themselves for use cases and utilities, we also have the staking platform, which says, if you buy 1,000 Arty tokens and then want to save those, you say, well, I plan on holding on to these. I like these guys, especially Dr. Frank. So I think I will hang with them fellas for a while, as Eddie Murphy said in Trading Places. So what happens is you can stake that for 3 months, 6 months, or 1 year. It's like putting it in a savings account. You'll get anywhere from 20% all the way up to 110% if you keep that in there for a year. So you'll literally over double your value in your cryptocurrency, and that can be kind of substantial as you go along. We have enough tokens and we have this models built into the system where that won't be an issue.
Can you discuss pump and dump?
Yes, I was getting ready to.
Yeah, because I really think that's so important that people understand that term.
Yes.
And how we avoid that.
Yeah, so let me go into that because I was going to cover that a little earlier, and I'm glad you mentioned that, Steve, because as I get on my tangents, sometimes I may forget that.
Yeah, I had to just interject and interrupt while I could. I had a brief second.
Yeah. That's why I will hang with you fellas for a while. By the way, Trading Places is it's a holiday tradition for my wife and I since it's been out. So every year, I just love that movie. But a pump and dump, it is very simple. A lot of people try and be all elaborate. It's where projects are created, and you have things called honeypots and unrenounced contracts, and we will go into that. We're going to make more videos on crypto to hopefully help people along with our healthcare and different topics, because we cover about everything. We're kind of like the Amazon of podcasts. We have a little of everything, literally. Mm-hmm. Yeah. So a pump and dump is simply, let's say somebody creates a crypto token. They can spend a lot of money on advertising, get everything hyped up that it's the next big coming. It may just be what's called a meme coin or a community coin, where it has no intrinsic value as far as they don't have the gaming, they don't have staking, they don't have NFT platforms, they don't have dApps, which are like apps, but they're decentralized, or blockchain versions of them. And so what they do is they get all this hype built up, make everybody think either through a pre-sale or a launch that they're going to be the next Bitcoin. to make it simple. And so millions or hundreds of millions of dollars get pumped into that. Well, the owners hold the majority of those tokens. And so they have control of that. So after it gets to a certain peak, you may see that thing go way up here. All of a sudden it was at sub pennies. Now that thing is up to 10 cents. When it's up to 10 cents, and I've seen it, and Steve and I've seen it done at just a few $1 million and sometimes hundreds of thousands, but even at the tens of millions or hundreds of millions, as been the cases, those things go up. And then what happens is the people who own all the tokens up there in the project, they dump it out. So they cash all their tokens out. Now your token's worthless and has no value. And so to prevent that, we actually have our tokens locked so much in liquidity, so much is locked in a wallet, which is where you store the crypto, is locked in a digital wallet for like charitable donations. Steve and I have a small portion of tokens, but we have an agreement that we will not just sell these tokens out just to make it a pump and dump. And one of the biggest factors with a lot of these, they're overseas tokens a lot of times, because you don't get that in the US. But because of his smiling face and mine, you're gonna know where to come to and you're gonna know who we are. Why in the world would we create a project to do that if we're putting all this out there and we're making sure that people know us and we're vetted? We have our projects, we're vetted, we're KYC, we've had international money laundering clearances. I've had clearances because of the military, Steve obviously being a retired chief of surgery and me being retired law enforcement and a US Army veteran and also a Christian, which is my biggest asset. You know, whether you believe us or not, there is no way we would ever, because we want this project to be long-term. As Steve says, his goal is to have the Arty Project help fund, along with the gallery, the point to where art therapy and the things we're doing become usual and customary and are the gold standard out there. We want to be the top healthcare and art token on the crypto marketplace, period. And those that get in early, you can just go on and do your own research. You're going to find out that you'll be hating yourself a little later if you don't get in early on this crypto project. But that's what a pump and dump is, and a lot of them unfortunately going out there. One of the problems we've had is that the SEC has been bickering back and forth with the current administration for, you know, literally since they've been in office. And I understand some of their points, and some of the points, you know, you've got people who absolutely don't want crypto in because they wanted a US digital dollar, and that's not going to happen. And so what ends up happening is looks like we're going to get people who are favorable to crypto and deregulation, because it's pretty simple. You know, if you look at the assets, and if it's a utility token versus a meme coin versus a stable coin, you know, you have a store of assets, and that's it basically. What does it do? And is it just there for profits only, like a bank, or is it set up to where it's more community-based, which ours is, and more utilitarian, which means for everybody to be able to use it and accomplish something out of it? And so the Arty token, it's just called Arty, will be available on Uniswap and a lot of other you know, crypto exchanges. As a matter of fact, as we go along, one of the things we wanted to do, which is to help with healthcare systems and cut costs, and for healthcare employees and then their families, is we are actually creating, which is one of our goals, because we have several, and I can't go through all the different technologies that Steve and I own and have developed in blockchain, but you will see a lot of them listed and becoming listed as we go along, because we don't want to throw everything out at first, because that could be overwhelming to people. But like besides the educational and literacy system, there's also the Arty payment system, which is just a payment gateway and where people can utilize, which has very low what they call transaction or gas fees built in. And so that will help out. It will also help out if people want to use the Arty token as we go along. That is where we would have to either break part off, or then, as we've talked to the SEC on several occasions, and our attorneys, we have the largest crypto law firm in the world, which does a fantastic job, so shout out Floor to that. And what we want to do is make sure that as we go along, whatever needs to be met legally, professionally, and honestly, that we're going to do, because, you know, we all have families, Steve and I, and we want to make sure that we can look them in the face, look them in the eye. And I've been where I'm at and don't plan on leaving where I'm at, so anybody can find me, can find Steve. He's been there, you know, for what, 80 years now?
A long time. Long time.
A long time, decades.
I would like to say that a lot of this, it seems tremendously overwhelming.
It is.
At first. So, and what we want to try to do is try to make it as simple as possible. And one of the things that I want to drive home is that when we talk about usual and customary, it's like this is not a big leap, because it's been used in the VA system since the 40s, and it's been used very successfully. You can look it up. There are several articles about how art therapy literally has saved so many veteran lives. Mm-hmm. And you don't know, realistically, I don't want to get too much into it, but if you look at, let's just say for an example, a lot of this art therapy is used in children because they can't talk, they can't verbalize what they've been through. And I'm going to give you, this is an extreme case, but let's just say, for example, if you have a child who's been through some sort of traumatic event, they undergo art therapy where they're working with a trained professional, something like that. They discover that there's some severe mental issues with this child. And you don't know what that child may be thinking. You don't know whether that child may be thinking like, at some point I'm going to go get a rifle and shoot up a school. I mean, so it could be involved in preventing something like that. That's an extreme case, but it's very real. And the thing about the art therapy, healthcare in general, again, when we start talking about quantitative studies are lacking to a certain degree in this, in the fact of, objectivity, just like, okay, here's somebody who's had cancer and chemotherapy and radiation, who had art therapy, same kind of cancer, no art therapy. That would be kind of like one of the studies. But like, no matter what those studies show, there's absolutely, positively no question that art therapy will improve quality of life. And that is immeasurable. That is immeasurable. But improving patient outcomes and quality of life, the mentality of the patient, the mentality of the patient's family, the mentality of the caregivers are all taken into account. And I talked to a colleague about this, and he says, like, well, how does that help me as a surgeon? I was like, well, let's talk about that. Have you ever been sued by a happy patient? And he said, like, well, you got a point. So all of this.
What about, not to interrupt, but what about physician burnout?
Yeah, and physician burnout.
Patient, or a healthcare advocate or employee burnout.
Yeah, and this goes along to like first responders, physicians, and there's been studies that have been released showing the stress levels in physicians. Now I'm talking about physicians who are out practicing, physicians who are out teaching. And that stress level goes down to the pre-med level. So, and I can tell you, pre-med is like one of the lowest rungs of the ladder, because it's like, if you make it to the next level, you go to med school, and that's a whole nother trough, if you will, in the scheme of things. But pre-med is just like, you haven't made it yet, and you may not make it. And so the stress level of trying to get into medical school is tremendous. And so physician burnout and is what has gotten as high as like 60-70%, the record highs. But art therapy has been shown to help with that. So it not only helps the patient, it helps the doctor, and it helps the med students and the pre-med students.
And can help the family members who are dealing with it.
Absolutely, it absolutely can. So this is, and as a surgeon, I can tell you, we are the hardest group of doctors to embrace some sort of mental benefit of something. Because for us, everyday life, our everyday life as a surgeon is like, most generally, you are dealing with one life-threatening illness or injury a day. You're facing that all the time. And so this art therapy, I believe, has a place that it must be done. And to make the transition like what's been done in the VA, it just needs to be done in the private sector. It needs to be embraced by the private sector. And I have no doubt it will be. And we want to be on the forefront of that.
Yep, to help
and we are
research.
on the forefront
we
of
are.
that.
What we've been doing.
And as far as I'm concerned, we are leading the pack in this, and that's what we want to do. And we want to build a community. You know, our community is like, okay, yeah, you may not be a patient, you may be somebody who's created art and successfully sold art on our gallery, or you may be a patient and you're working to do the same kind of thing. But that community, that strength, is all about health and well-being.
Yeah, because you might be a healthcare worker that says, you know, I'm not really into art, but I am into anything that helps stress levels in patients and cuts cost and makes my job even easier or less stressful. So, you know, it really does cover the world.
Yeah, and when you look at some of these things, when I look at some of these cases that I've studied about art therapy and some of the things that they've uncovered that patients would not verbalize, but they have uncovered during art therapy, I mean, it's remarkable.
It is.
It's remarkable.
Yeah, and the Arty Project, like I said, Steve and I have had blockchain technology for a while, everything from data security storage systems to, and we've never implemented, to, you know, exchanges where it's in its actual exchange where you can buy and sell crypto and all this. So all this we've decided to give to, which is really what we're doing, give to the Arty Project. Because if you look at the top 5 medical tokens and top 5, if there are 5, art tokens, Arty fits in with what it has, and I know I'm being biased, but literally Arty puts all of them to shame in what we actually have and what we want to accomplish and what we actually are accomplishing. So with all of you, we invite you to be part of that community because, you know, if you just do your research, you're gonna go, man, these guys are not only passionate, but they've got some solid backgrounds, they've got some solid, you know, a solid blockchain project, they're vetted, all these areas, and we're going to advertise as much as we can. We're already doing like articles and everything for the Arty Project. It really is such a multifaceted project, because as a healthcare token and an art token, I just think, as Steve said, we're going to be leading the way from day one when we come out, because we will be launching here very soon. Everything's ready to go. It's just we wanted to make sure that we had everything quadruple checked and audited, and it has been, and everything's fine. So just watch for it. And have I left anything out, Steve? Did you think?
No, I think one of the big things that you talked about earlier, and it's so important, and it's because, well, you and I, we've been involved in these kinds of projects where, you know, it was like a pump and dump kind of thing.
As investors.
Yeah.
Not
right. As investors, I mean,
we tried to get involved with one project that got to over a $12 billion market cap and is now defunct. We offered them the same things that they were saying they were going to do. We offered them, because we have tech teams and people that develop and actually functional working items, and they felt that they knew it all and they did it all, when in reality they didn't have any of that stuff created. And so I don't know how you do that, but that was probably one of the biggest pump and dumps in history, and we won't go into who it is, so the name or anything right now, but it is, and we have all the evidence and proof that we did it and tried to, and we're not trying to be arrogant, but I think if somebody comes in and says, listen, you're saying you got all this, but you don't, we can actually provide it, and we'd love to join in with your team to help. And then they basically tell you, no, we're the smartest people in the world, we'll do it. Now they're all, you know, sitting there selling melons over there in the Philippines or something, or wherever they took those, you know, hundreds of millions of dollars in liquidity from that almost 12
and
million.
it's kind of like the movie Taken, when you know, when you're trying to find some of these people who created these things, and then they steal your money and then they're gone, or, you know, and they can just say, we're going to find you, well, good luck, because you won't find them.
Yeah.
I mean, they're going to be just dispersed all over the world. But
And we is not leaving Bowling Green, Kentucky.
no, We're right here.
As my students tell me in martial arts, I have the worst Southern accent in the world. But I'm working on it. I'm working with a therapist.
You got a long way to go. I can tell you got a long way to go on how to speak Southern.
I'm still trying to work on my Gazentas.
But the thing is that we are here, and our goal is to be. We are combining art with healthcare and doing it in a crypto world.
Yes.
And it makes us extremely not only unusual, but we're the leaders in it, and you have to be innovative. And I feel like that we have been very innovative, and we continue to evolve and grow.
Absolutely.
And we understand, the thing about it is with our backgrounds, and especially I've got to say, Frank's technology background and the way that he's embraced this and moved is incredible. And the whole thing about us is that we have a good intention first, a foundation that's real, rather than just like, we're going to set this up to scam people, make a lot of money, and then leave. You know, we're here to serve, and that's what we want to do. And we want to do it in a very constructive manner, and we want to bring the world along with us. And it's my understanding there's around 2 billion people that create art, something like that. We invite all of these people, come on board with us, and let's, we really have a chance to revolutionize a segment of healthcare that needs to be changed.
Absolutely.
It needs to grow, and it needs to change. Because if you can start talking about, again, a perfect example, there was an article I read about a woman who had cancer. She was taking chemotherapy, and she was very sick a lot of times. I mean, I know my mom went through it with ovarian cancer. I saw how sick she got, that sort of thing. And the pain factor, the whole emotional factor of having cancer. And she said, like, I was identified by my friends and family as a cancer patient. And they were heaping pity on me, and it just made me feel worse. And it instead of inspiring me, it just dragged me down. And she said, but I started to create art. And then when I started creating art and then showing it to people in the hospital, they started calling me the artist. So I was no longer the cancer patient, I was the artist. And she talked about how that took her life as a cancer patient from one that was in self-pity, pity from other people, being depressed and basically miserable. When she was involved with her art, she said, I thought nothing of my nausea, nothing of my pain. I was completely in another world. That was in the short term. And then in the long term, when they started identifying her as an artist, it changed her life. And so that's what we're talking about. That's what we want to do on a massive scale. So that's what we are all about.
And that's why one of the biggest projects we have coming out in the first quarter of 2025, it's ready, but I want some fine tweaking because I haven't seen a project like it, which is the ARTIE. It's the William Snodgrass, but it's the ARTIE project. It's our Metaverse Art Gallery. And there's a lot of Metaverse art galleries out there. They're either on AWS or whatever they're running on. That's fine. But ours is not just about digital assets and NFTs. That's part of it. So you'll be able to go on there, do your little avatar, actually VR system, whatever, go in and actually explore the art gallery. But people will be able to create an account, take something that's a physical object, say it's a sculpture or a painting, they can then digitize that just usually with their smartphone, and then upload that. Of course, you may want to put the dimensions, and we'll have all that explanations on there. We're big about having video explainers on our websites, and the website is ARTIE, ARTIE Project, PROJECT.com. Very simple. ArtyProject.com. Sound like Ted Cruz. Go to ArtyProject.com. Go to ArtyProject.com. But the Metaverse Art Gallery will allow you to actually use the smart contract and the blockchain to actually, for a store value and a value-added proposition, by putting something that you normally may have in a gallery or in a show or at a a flea market or wherever you want to sell your goods. You might say, I'm trying to do this, but I have to advertise it. That will allow, literally millions of people to see it. They can just, if they like it, they can click on the QR code, takes them right to the sales page, and it gives either your contact information or where they can purchase it. We have a super secure security team for payment systems. You are in control of all your payments. You're in control of everything that you do. All we do is make sure that we just okay the release when the person receives the art. Now, if it's digital and it's downloaded, it's instantaneous. But if it's something where the buyer needs to get it shipped to them, and then you fail to do that, those funds won't be released. I just want to bring that up because we've talked about it in the past. So it kind of makes it a safe way, because I don't want people coming to me and Steve say, hey, I just paid $1,000 for this sculpture and I paid, $300 to get it shipped. I never got it, and now they're saying I'm not getting it. And so they're going to be looking at me and Steve as on the old Lucille Ball show. You got a lot of explaining to do, Lucy. Yeah, that ain't going to happen. So we're very tight on cybersecurity in those areas, and to make sure that everything we have, if we can help it, is hack proof. And we're always available for questions. We're always available at artyproject.com, artyproject.com. It'll be on the video also. But that's all I have for that, because I'm excited and looking forward to this. And we really do not just want to be, the leaders we want to be a top level crypto, where our goal is to be in the top 50 cryptos. And then that's, I think, with everything else Steve and I have accomplished, that's saying something. If you do your research, you're going to say, man, how can I get in with these guys? We have a lot of tokens, and they're going to start out extremely cheap.
And the thing of it is, again, I understand, believe me, I understand, because when you see something like this podcast and this material and contents that's covered in this podcast, we're trying to put it in a format where you'll understand it and not be overwhelmed. But no matter what, it is overwhelming. Mm-hmm. It's new and it's innovative and it's overwhelming, but we must lead in this space as a country. We must lead.
Yes, the U.S. has to lead, because everybody's going to be looking to us to do that.
Yeah, and healthcare is the same way, and I do believe the changes that are going to be taking place next year in regards to prevention of disease, that sort of thing. Those are areas that we focus on as well. How many times have we talked about how much easier it is to prevent disease than it is to treat it? But we hit both sides. We want to prevent disease. Obviously, we don't want people to get sick or hurt. But when you are and you become a patient, we want to make that experience as good as we can for you. Because I'm getting ready. I'll go into my own personal case here. I had a bicycle wreck 10 years ago, broke my hip, had hip pins put in, and then started experiencing pain 10 years later. And now I just discovered I've got avascular necrosis of my femoral head. I'm going to have a total hip next week. So I'm going to become a patient again. And so I'm going to be doing everything I can to make my life as good as I can while I'm a patient. So that's the same thing that we want to do for you. We want the patient experience to be the best it can possibly be. And we are two people who are used to and accustomed to telling the truth. Mm-hmm. Telling the truth.
Whether people like it or not.
Telling it as it is. And this project is no different. And so we're not here to make a fortune and say bye-bye. We're not here for that. Do we want to make money? Sure, we want to make money. But we want you to make money, and we want you to feel good about yourself and your family along the way. We're doing something that's extremely
funding research, development, and of different programs for art therapy, helping fund small clinics or large hospitals that don't have art therapy departments, to help them be able to bring those in. It's just patient-centric, basically.
Yeah, and then, this should just be standard care. Mm-hmm. It really should be, and the patients will have the option of whether they want to participate or not. But it's one of those things that we want to work with industry leaders in healthcare to make this a mass adoption.
Right.
Yeah. again, usual and customary, and along the way, how you get there, the Arty Project.
That's
Arty
right.
Project.
ArtieProject.com, ArtieProject.com. I don't have the beard that he's got now, but well, that's all I got. I appreciate everything, and be watching. We will be doing more videos on the different aspects of the crypto, like the metaverse, the staking. We'll put out, small videos to kind of show and explain what those are and how they work, and then actually show you the platforms and the videos to help you. But everything will be on the Arty Project. How to buy the Arty token actually will be on the explainer video on the website. It's not on there yet. There are several other videos, but that one will be coming out once we actually launch. That will be ready to go to walk you step by step how to create a wallet if you never have, and then how to actually buy whichever way you type of currency or credit card you want to buy with. It will allow you to get on there and do that. So as usual, stay healthy, stay safe. We just appreciate you folks.
Thank you much. Bye.
Thanks for listening to the Dr. Franken Steve Podcast. If you enjoyed this podcast, please hit follow or subscribe on the link provided so you can stay up to date on new episodes. Until next time, stay healthy and stay safe.